myself Dr.Shruthi Eshwar, Associate Professor from Department of Public Health Dentistry from KP Institute of Dental Sciences, Bangalore. And today I'm participating in Save the Tooth campaign, and I'll be going to speak on what is the role of tongue in oral hygiene maintenance or oral health maintenance. So, majority of us feel when we hear the term oral health or oral hygiene, we always think that oral cavity or our mouth is only just the teeth or the number of teeth present in the mouth. But that's not true. The oral cavity includes the teeth, gums as well as the tongue. So, whenever we have made it a mandate that daily brushing 2 times or brushing once daily is just cleaning our teeth. That's very wrong what we are doing. Cleaning our mouth doesn't mean that you have to just clean your teeth. So cleaning teeth only will help you make the teeth to be fit. If you want to have your mouth fit or mouth in a healthy condition, then you have to take care of your mouth, you have to take care of the soft gums which surround the teeth and as well as your tongue. So I believe that everyone knows what the tongue is, an important part or important organ in the body. Why tongue is an important organ is because not that just it helps in digestion of food. So what happens is when we take food, the tongue helps in the movement of the food and we try to swallow, that is we chew the food and it helps in swallowing and speech, for the taste of the food, everything. So in this process of digestion, if you know that tongue has some small tiny spots, reddish tiny spots on the sides as well as on the border sides and on the lateral main surface of the tongue. So that we call it in scientific terms as papillae. So what this papillae does is whenever there is in the process of digestion of the food, this papillae try to accumulate the food debris. So the food particles go and stuck in the tiny spots. So this food debris, and it also accumulates what is called as dead skin cells. So this food debris, what it does is it tries to form a biofilm. So this biofilm is just like a layer which is found on the the tongue. So this layer what forms on the tongue tries to accumulate the bacteria. So when we hear about the term bacteria, everyone gets panicky, and now being in the pandemic, these words like bacteria, virus, all this, we get fearful because only the biofilm we are not bothered. Okay, it is just the layer which is formed on the tooth. But bacteria, you get to know that there is some infection which is going to happen. Either it could be a bacterial infection or a viral infection or a fungal infection. Anything can happen. So how do you avoid this bacteria? So you have to clean your tongue. So if you don't, or if this bacteria keeps on accumulating, then what happens is it leads to bad breath, what we call it as halitosis. Halitosis is also a disease. So this bad breath comes. So whenever you have a bad breath, then you will certainly lose the confidence. The self-confidence goes, because when we are communicating with others, that there is a bad breath, then nobody will speak to us. We will have this. So that will lower our self-confidence. But all this can be prevented. How is? By proper maintenance of the tongue. Okay. So in order to maintain the tongue, what we have to do is we have to regularly brush our tongue along with brushing our teeth. So how do you brush your tongue? Okay, so brushing your tongue can be done with the same brush with what you use to brush your teeth, but not directly with the bristles. You can use if you are using bristles, then you have to gently brush your tongue, not vigorously as you do it for the teeth. Second one is you can use the back head of the brush for cleaning. That will also serve the purpose. Okay. Otherwise, in market there are many commercially available products like tongue scrapers. You must have seen there might be plastic scraper, or there might be a stainless steel scraper which people use. It is usually in a U shape, and you just hold it on the either sides and you try to scrape your tongue. That also very gently. Don't do it because it has many vessels, blood vessels, so it starts bleeding. Okay, so this is how you're going to, why you have to maintain your tongue and how you're going to maintain the tongue. Apart from just the oral hygiene maintenance, this very important factor why you have to maintain your tongue is, unlike, see, I've told you tongue is also a vital organ in the body, and this vital activity of the body means any organ system, any one vital activity of the body, we all remember and we know that it is always tested through the blood, through sweat, through urine, or through feces. All this can be used as an investigation route, but tongue is also can be used as an investigation route. Tongue helps in identification. Whatever changes happen to on the tongue helps in identifying the disease. What disease? It could be the liver, it could be the lung disease, any stomach infection, heart issues, as well as your kidney issues. So you can identify. I will just tell you there are many in the change in the color of the tongue, whether it is a white coating what you see on the tongue, or the reddish tongue, or the completely pale tongue. That is usually the tongue is mild pink or mild reddish in color. Okay, if it is more reddish or if it is very pale in color, that indicates anemia. You don't have you will have something related to blood. Anemia, I agree, everyone knows about this, anemic conditions where the blood count is very less. Second thing is there could be a white patch which is formed on the tongue. So what is this white patch? If this white patch is formed on the left side or on the right side or on the center, it indicates the disease. Left indicates any white patch which is seen for, and if there is just white patch on for one day, it doesn't indicate any infection. If you continuously come to see that there is white patch which is even after cleaning which is remaining, then it indicates left side it is more certain for the liver infections, right side it is more for the lung infections, and any white tongue in the center of the lung, that is middle part of the lung, it indicates the heart issues. Okay, so the lungs, basically the respiratory, you can see the problems in the tip of the tongue. Okay, the tip of the tongue which indicates these problems. So you have to not only just cleaning your teeth when there is continuously or for the persistent that white patch is there, you have to go and see a physician and try to get full body checkup and try to investigate or diagnose your underlying condition at the earliest. Okay, so these are some changes what I have told, like how tongue can be used for identification, possible identification or a possible indicator for systemic infections, or how tongue is responsible for oral hygiene. That is basically if we don't clean our tongue, it will lead to bad odor. Third one is even you can identify HIV. Okay, that we call it as hairy tongue. Okay, so that is what, there are certain infections, many viral infections, bacterial infections and fungal infections, and sometimes when you are on antibiotics, taking antibiotics, that will also for temporary reasons go for white patch, but that will come down. But if it is not coming down, then you can think of any problem with the liver, lungs or stomach or your kidney, or there is some fungal infection which is called as candidiasis. Okay, so these are the certain small tips which I would like to give on what is the importance of tongue and how to clean your tongue. So cleaning your tongue should be basically with the brush. Just don't have a notion that if I rinse my mouth, my tongue will be clean. Rinsing will not give us sufficient or an efficient results for tongue cleaning. Why? Because it will just kill or destroy the outer layer of the biofilm. It will not attack what is present in the inner layer. So I hope with this small information on what I have given on the basic information on responsibility or role of tongue in oral hygiene maintenance as well as general hygiene maintenance will help all the target audience. Thank you one and all.